Hi, this is Dr. Stephen Katz, owner of the alternative medical clinic based in Scottsdale, Arizona called Naturopathic Physicians Group. I co-host Your Health is Wealth. I hope you enjoy this informative natural medicine podcast and listen weekly for the newest installment. You can learn more about us at naturopathicgroup.com.
Today, you'll learn about how to bank wisdom for a fuller, richer life. Your hosts are Dr. Stephen Katz, an award-winning naturopathic doctor and former president of the Arizona Naturopathic Medical Association. Also, Dr. Loreena Ryder, naturopathic doctor and current board member of the Arizona Naturopathic Medical Association.
Welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my two co-hosts, Dr. Loreena Ryder and Dr. Hannah Lindsay. We're here to help you navigate your journey to wellness. We like to do this without all of that crazy, horrible medical terminology. We like to give you practical solutions to your health issues that allow your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, we are the doctors from Naturopathic Physicians Group, and we're here to help you get your life back.
So, hi everyone, this is Dr. Lindsay. Every week we like to chat a little bit about what is a naturopathic doctor. So, a naturopathic doctor can provide primary care as well as specialized care. We like to look at the body as a whole and determine the root cause of your symptoms. So once we find that root cause of what's going on, we like to treat the cause rather than just treating your symptoms. So your initial appointment usually runs for about an hour, so we can talk about everything going on in your health. We believe that prevention is the best form of cure, so we like to help our patients get better and stay better and really improve their quality of life.
And basically every question your doctor forgets to ask you, that's our job. That's what we do.
Every week we like to do a different topic of the day and give you just a broad understanding of your health. And this week we're talking about the flu. The flu is an abbreviation of influenza A and B, and this is different from the common cold, so we're not talking about the common cold this week, but the flu as a respiratory infection caused by a virus. Now, I was looking at the Maricopa County Public Health Department website, and I found it quite interesting that they have deemed the flu season year-round. However, they did show spikes and so on and so forth, different months of the year. And when the weather gets cooler in December, I mean, as cool as it can get in Phoenix, and then in January, it does tend to spike then.
Well, if you sneeze on somebody and goes to that person, they sneeze on somebody and goes to that person, it's just a constant revolving door.
It is, yeah. So right now, the flu in Arizona currently is categorized as sporadic. So the flu activity is low. That was actually their next to the lowest category that they had. So that's good. We're in the green. But that's what we're talking about today to help you prepare for upcoming.
But fall's starting. Things are going to start to fall. We're going to get more crap in the air, and we're going to have another spike. So we're here to...
Mm-hmm. And holidays always spike any type of virus.
That's because we see all the people that we love so much and see all the other ones we don't.
You're so kind.
Everyone gathers and brings the flu with them.
Yeah, so symptoms that you might experience with the flu, and you'll be very familiar with these: fever or just even feeling feverish, and chills typically go along with that. Cough, sore throat, congestion, runny nose.
And a very common one people get is low back pain or muscle aches and pain. So when they have the flu, they have all the symptoms of the fever, the chills, the cough, the mucus, but then out of nowhere they'll be like, man, my low back is really bothering me, and it's definitely a common symptom of the flu.
You can also get headaches. Fatigue is very common with the flu, just feeling like you don't have any energy. That goes along with weakness. It could feel like muscle weakness or just overall body weakness. And you also could have the flu manifest more in the GI tract, showing like abdominal pain, loss of appetite. You might also have vomiting and diarrhea. Everyone presents a little differently. So it could be all of these symptoms. It could be just a few of them in different combinations.
And if anybody's ever had the flu and you hear all those symptoms, you'll be like, yep, I had that. I did that. And so most people are familiar with the flu. It's pretty common, but they're not always familiar with the different types of the flu, and they're also not familiar with ways they can treat it that aren't the typical things they think of.
Mm-hmm. That's where we come in. So there are basically 4 types of influenza virus: A, B, C, and D. Super easy to remember. The most common is type A, and this can spread from animals to humans. This is the type of flu that's responsible for pandemics and global eruptions. There's also, go ahead, did you have something to say? Type A?
No.
No? Okay.
I am a type A.
Okay. Type B, similar to and can be as severe as type A. Now, this form can only be spread from human to human. And this is the type of flu that typically causes our seasonal outbreaks, and it can be transferred throughout the year. But oddly enough, some of the research showed that type B influenza can affect seals as well as humans.
Are we talking Seal the musician or Seals the animal?
You know, he was a great musician.
He was good. I
But
have no problem with that.
I'm pretty sure he's covered under the human category.
He might get the flu.
He might. He's definitely part of both then.
But if you go to SeaWorld and you get the flu, it might not have been from the people you're sitting next to. It might have been the seals.
It could have been. If they had runny noses, then they're likely candidates.
How would you know that with all the water?
You wouldn't. Sneaky.
That's not fair.
There's also type C. This is the mildest version of the flu. Don't hear about that too much. And then type D infects pigs and cattle, but not humans.
So when we're thinking about all the different types of influenza, we're really thinking type A or B. A is from animals to humans, and then B is human to human contact.
And most of the prevention that's out there or the treatments for it are going to be targeting A and B, because C is so mild that you probably didn't even go to the doctor to even get it diagnosed. Mm-hmm. But contagious, this is a very, very contagious virus. Again, person to person, you can get direct or indirect contact. So if you're in a movie theater, if you've ever seen the movies where the pandemic starts, somebody coughs and now the whole movie theater's sick, that can happen with the flu, but hopefully not to the pandemic level, of course. But very, very contagious. All you need is those droplets and breathing it. If those droplets from a sneeze or a cough from an infected person and you're around the area, it's a very good chance you will get the flu. Doesn't necessarily mean it's going to become a really bad flu because everybody's immune system's different, but if you're around there, it's very likely you're going to get sick.
Mm-hmm. Yeah, just touching an item also, like door handles, anything that's been contaminated by the virus, and then touching your mouth, your nose, or your eyes, any of our mucosal areas. So door handles, a phone, a pen, money carries a lot of viruses. And, you know, even a desk or a table if you're going out to eat or using somebody else's desk.
Just don't touch nothing and don't be around anybody that breathes, and you're probably going to be safe from the flu. That's simple.
That's where hygiene comes in. You know, we can't live our lives without touching things that could potentially be carrying stuff. So just make sure, you know, you're being diligent, washing your hands, having personal hygiene.
Sharing is caring, but you don't have to care so much to share the flu.
And also sharing drinks and food. Like, I mean, high school kids and middle school kids and elementary school kids are kind of bad at this, but you're bound to end up with what the other person has if you're sharing a drink or food or utensils if they're infected with the flu.
And the highest risk people to actually have a really bad infection where it can actually kill you, mortality, elderly, people over the age of 65, infants can be troublesome for them as well, and all the immunocompromised or the autoimmune patients or patients that have gone through chemo with cancer. When your immune system is weaker, it puts you at a much, much higher risk with the flu.
So thank you for tuning in to Your Health is Wealth. We are Dr. Stephen Katz, Loreena Ryder, and Hannah Lindsay from Naturopathic Physicians Group, located in Scottsdale, Arizona.
So every week I do a segment called What Isn't Your Doctor Telling You? This is not an anti-doctor segment, but when you have your visit with your doctor and it's only 3 minutes long, you're not going to get all of the information you need in order to make good quality healthcare choices. So I like to give a tidbit every single week to give you good information moving forward. So this week I'm actually going to talk about the flu shot. The flu shot is one of the most common treatments they use for preventing the flu. And a lot of people react really harshly to the flu shot and don't know why. The virus they inject is a dead virus, so why would you react horribly to it? There are preservatives in there that can cause problems. We'll talk a little bit more about that later. But one reason that people don't always know about is that the flu shot is incubated in eggs. And we've talked about food many times on here, but the second most common food sensitivity out there is eggs. So if you have any kind of food sensitivity to eggs out there and you get a flu shot, you have a much higher chance of reacting really harshly to it. And they make egg-free flu shots, so in the future, if you did decide to do it, you can find one that you might have less reaction to. But the other thing is, if you react really harsh to the flu shot and don't think you have a sensitivity egg, you might actually have one and not know it. So if you react to a flu shot, it's a good idea to try and figure out why.
The egg sensitivity thing throws a lot of people that I've noticed, and it makes them sad as well because eggs are, they're like a great protein, right? But if you don't react well to them and your body just doesn't like them, there's not a whole lot you can do about that.
And there are so many people out there that have sensitivities that might not know it's from the egg because of the way our digestion works.
Exactly. Yeah, so we can talk about a few traditional diagnostic tests that are typically out there checking for the flu, and you've most likely heard about these. But the flu tests require a respiratory sample using a swab in your nose or the back of your throat, and it checks for the presence of the flu virus there.
And with COVID, we all had to get tested probably 11-5 times. And so by getting tested all the time, we're all familiar with what those swabs feel like in the back of our nose. It's pretty similar.
I was surprised, though, it doesn't feel as bad as what it looks like.
It doesn't look fun.
It doesn't. Like, how far are they putting that thing in there? The rapid tests are called Rapid Influenza Diagnostic Tests, or RIDTs, also called flu antigen tests. So these detect parts of the virus, which are the antigens, that stimulate an immune response. These tests can provide results within 10 to 15 minutes. So typically, as you're sitting in the urgent care office waiting for those results, they're available before the end of your appointment. Now, these may not be quite as accurate as other flu tests. Therefore, you could still have the flu even though your rapid result is negative.
Yeah, so those rapid tests are what you're going to find most commonly when you present to a clinic with the symptoms of the flu. That's going to be just a quick swab they do. But there are some other tests that you can do to diagnose the flu. There's something called rapid molecular assays. These detect genetic material of the flu virus. So these produce results in around 15 to 20 minutes, so they take a little bit longer, but they are more accurate than the rapid influenza diagnostic tests. In a hospital setting, there's also more specialized laboratory flu tests. So these are going to be more accurate than the RIDTs and the rapid molecular assays. These tests include reverse transcription polymerase chain reaction, which is long for RT-PCR. They also include viral culture and immunofluorescence assays. So these tests, like I said, you're going to find more in the hospital setting, and they're going to take several hours to days to get the results.
Even with these tests, diagnosing the flu is generally based on symptoms when you're in the office. Oftentimes, you're not going to run a ton of tests. You're just going to be treating as if they have the symptoms of it and they feel like crap and they want to be treated. So it's not always that you have to run one of these tests. If you have all these symptoms, a lot of the treatments for it are similar, regardless of whether that flu test comes back positive or negative.
Right. So let's talk about some traditional treatments that are typically out there, and most likely you have heard of or even had one or a few of these. So the flu shot is a traditional treatment, and there are different flu shots. Now, these work only as a protection if the strain of flu you get was the strain of flu you had in your vaccine. Now, I remember learning this several years back, and I don't know that many people know this, but this is how it happens. Each year, the FDA gives their best educated guess at what strain they think the future season will bring, and that's what they put in the flu shot.
And they're usually wrong.
You have a 50% chance, right?
Correct.
Let's flip a coin.
But almost every year they come out at the end of the season and say, well, we thought it was going to be this one, but it really wasn't. Then they say, However, if you got the flu shot, it likely made you have some protection anyway, so it didn't go as bad as it would have. I love that idea because there's no physical way to actually test if that's true or not. But, I'd love to have an idea and say, hey, this is 50-50 chance this is going to work. If it doesn't work, it likely worked anyway. That's how they pretty much use the flu.
Well, so they put the strain that they guess in the flu shot. They give everybody the flu shot for the season. And at the end of the season, they were like, well, was it the one or no? Oh, shoot, it wasn't. So you've gotten your flu shot, but it was, not.
And I'm not trying to be harsh on it. It's just almost every year they come out and say, it didn't work. Great. 160 million doses later. Just saying. So one of the common flu vaccines out there, they're called trivalent, tri meaning 3. This one protects from 2 different strains of influenza A and 1 strain of influenza B. Like I said during the What Isn't Your Doctor Telling You segment, this is an egg-grown flu vaccine. You do it into the muscle of the arm, and this is the most common one they give people in the age group between 18 and 64.
So another type of flu vaccine is the quadrivalent. So like the tri is covering 3 different strains. Quadrivalent, that's quad for 4. These flu vaccines are protecting against 4 different strains of the flu virus. So this is going to protect against 2 influenza A viruses and 2 influenza B viruses. So because it is protecting against the 4th strain, it is a bit stronger than the trivalent. And this vaccine is available in high doses in the 65 plus age group, just because the elderly and also immunocompromised patients, like we mentioned before, are at higher risk of complications from the flu and mortality from the flu.
There's also a recombinant flu shot. They're produced without an egg-grown environment, and it does not use chicken eggs either in the production process. So these have less allergenic problems and also less side effects.
And we're not telling anybody not to get the flu vaccine either. It's just giving you information so you can make the best choice for you. One of the big things when we have patients ask us about the flu vaccine, we always tell them we can't tell you yes or no. We just give you information. One of the ones we will, if they're going to get the flu vaccine, one of the things we usually push them towards is the preservative-free flu vaccines. Flulavol is one of the companies that make it, but if it's a single dose versus a multi-dose, when they use multi-dose vaccines, they have to put a preservative in there versus the single dose does not have the preservative. So we'll generally guide them, if they're going to get one, we guide them towards those single dose so it doesn't have the preservatives, because one of the preservatives they use in there is mercury. We've done talks on heavy metal toxicity, and we tell people mercury is a neurotoxin. We don't want to affect our brain, therefore we'll guide them towards one of those preservative-free ones. And just to say about on the packaging, it's not just the FDA coming out every year saying it didn't work. On the packaging, there's been many years right on the label for the flu shot, it will say there have been no controlled trials adequately demonstrating a decrease in influenza disease after vaccination. So again, there's no trials that actually says this works.
So if you want to, you can ask for the ingredient list. And it's not going to say mercury if that's what you're super concerned about. The ingredient list will say thimerosal, just as an FYI.
And side effects for the flu shots tend to be, the most common is going to be tenderness at the pain symptoms of the flu for a couple days. So yeah, you're taking a flu shot, then you feel like you have the flu for a couple days. It's not the flu, of course, but you'll get those similar symptoms for a couple days. And the worst case scenario is probably going to be the allergic reactions, which could be difficulty breathing, hives, heart racing, dizziness, a few other things.
So to jump into some more of the traditional treatments, so these are going to be more so targeted once you've already caught the flu and you're presenting with symptoms. There are a lot of antiviral drugs that are often prescribed for the flu. One of the most common is Tamiflu. A lot of people have heard of that. That's the first line for most people. However, a lot of people don't know it has to be taken within 48 hours of onset of symptoms or it doesn't work. So it can help with lessening the severity and decrease the length of the flu, but you got to take it right away.
Perfect. So we are going to talk a lot more about treatment options, both conventional and natural, in our next segment.
We are the doctors from Naturopathic Physicians Group, and today we are talking about the flu.
We choose the song Mission Impossible because that's our job as doctors. We take your conditions that you have gone through every doctor and not getting better. You feel like your journey to health is impossible. Well, we like to take that impossible journey and make it possible. In our last segment, we started talking about the antiviral drugs they use to treat the flu. And the first one we talked about was Tamiflu. And this is the first line therapy for most people. But as Dr. Lindsay said, you have to take this within 48 hours of using it or it does not work. And I mean within 48 hours of symptoms. And most of the time when people have the flu, those first day or two, it's like building up so you don't really feel like it's the flu. So this one is prescribed a great deal and works very rarely. And they tell you that this one will help with lessening the severity and it will decrease the length of your flu by a huge margin of 1 day.
So the other traditional treatment that is typically handed out is Relenza or zanamivir. Relenza is an antiviral drug that's available as an oral inhaler. And this one shortens the length of symptoms by less than 1 day. I have you beat.
Less than 1 day. I look at that as very comical because who the hell tests that? Oh, this was 4.5 hours better than you would have had. I'd love to see how they figured that one out. Oh, you did good. It was 8 hours better than yours would have been. Again, this is, if you don't use this right away, they say you have to use this within 48 hours as well, or it doesn't work.
Right. But also it doesn't appear to lower the risk of flu-related complications or hospitalizations.
The whole real thing to be afraid of is those complications with the flu. Otherwise, it's just another bug.
Right.
But it will help you 6 hours better than anything else.
I mean, that's a work day, maybe.
You shouldn't go to work with the flu.
So another antiviral drug that is prescribed is Rapivab, also called Peramivir. This is actually an intravenous antiviral drug. So this is going to be injected directly into your vein through IV. So it needs to be administered by a healthcare professional and would likely only be given in a healthcare facility. So patients that maybe catch the flu inpatient, this is a drug that's sometimes used in those scenarios. However, you're kind of catching on to the theme here. This drug also would need to be given within 48 hours of developing symptoms. Now, maybe if you're in an inpatient facility, you might have a better chance of catching, the symptoms earlier on.
Or getting the flu.
Well, yes, that does put you at higher risk as well.
You're in a sick person facility. You might get the flu, but don't worry. They'll hook you up to that IV and you'll be good to go.
So another treatment is Xofluza, also called Baloxavir marboxil. That sounds like a fun board game.
Baloxavir.
What did I say?
Baloxavir marboxil.
Right. Let's play Baloxavir marboxil. Okay. So Xofluza is a newer antiviral drug for the flu, and it does have FDA approval since 2018. And it does have some advantages over Tamiflu. Let's check these out. It shortens the length of the flu symptoms by about a day and lowers the risk of flu-related complications more than other antivirals for the flu.
So this one has advantages to Tamiflu, and it lowers the flu by the exact same amount as Tamiflu. Love it. It's just genius at work.
Are we done having fun with this yet? This is silly.
The meds for these are, again, if you need them and they help you, because it does help some people, great. But most of them, unless you catch it really, really early and you've got the right strain for it, these don't do a lot.
Right. And some of the effects of the antivirals are things like diarrhea, nausea, sinus swelling, and headaches. I mean, what does that sound like? Sounds like the flu.
If you don't already have diarrhea,
right,
nausea, sinus swelling, and headaches from the flu, don't worry, you'll get it when you take your antiviral.
In one way, out the other. It's the best way to go. There's also a lot of over-the-counter treatments people use for the flu. There's Sudafed, which is a nasal decongestant, so it takes the mucus. It helps you clear the mucus out. There's Tylenol or ibuprofen for the fever. So again, these are all symptom relief. There's Mucinex, which is a mucus thinner. also known as an expectorant, so it allows you to get that crap out of your chest. And there's also Robitussin. It's an old favorite for a lot of people, also known as guaifenesin. And this is just an anti-cough medicine. So these are found in prescriptions, some of them. These are found over the counter. They're all symptom relief, which can get people feeling better pretty quickly. But if you use stuff to lower the fever, sometimes you actually slow the virus down, or getting rid of the virus slows down, so you actually have it longer.
Right. So enough of this nonsense. Let's talk more about the naturopathic stuff that you can do to help the flu. And I have a tip of the week for you this week. So grab a pen and paper if you're interested in a...
Got one.
Oh, good. So you can write this down.
I'll write it.
In a non-tasty but effective recipe for flu symptoms. This recipe is an old folk medicine herbal tonic to help you boost your immune system. It also does help prevent the common cold and the flu, which we're talking about, and it even treats current flu symptoms. So this is called fire cider. And there are various forms of fire cider, but basically it is 1 bulb of garlic minced, 1 heaping tablespoon of turmeric root powder, or you can buy an actual inch root, 2 teaspoons of ginger root powder, or buy the actual inch root, 1/4 teaspoon of cayenne powder, or you can also use 1 teaspoon of red chili pepper flakes as a substitute, juice of 1 large lemon, and 1 cup of apple cider vinegar. Mix this together, store it in a glass jar. It's shelf stable. It doesn't have to be refrigerated, but you can if you want to.
I don't know why you say this would taste bad. Come on, garlic and curry. It sounds like dinner.
I mean, it does sound delicious, but goodness.
It's just a little potent, but I personally don't mind the taste of it. I think it's pretty good.
This works. I made one of these for my sister many, many, many years ago, and it cleared it right up. It ruined my kitchen, and it smelled horrible for 3 days. I had to get a new blender after it, but it worked. It shortened it by at least 1 day, so I would put that stuff up against Tamiflu any day.
It sounds more effective anyway, and please don't drink the whole jar. Just take 1 heaping tablespoon with a little bit of water. Just mix it up 4 times a day until your symptoms resolve.
And just warn your family you're going to smell.
Yeah, well, they probably don't want to be around you anyway if you're hacking and coughing from the flu.
You're going to have that stuff seeping through your pores.
Oh, yeah. You will smell like a bulb of garlic for sure.
But that's okay.
Right?
Garlic's good.
It's cleansing.
So to jump into a few more naturopathic treatment options. So a lot of these treatments are going to be kind of twofold. They can help to potentially prevent the flu when you're going into flu season, but they also can help treat the flu if you happen to catch it and come down with some symptoms. So diet. We always talk about diet, and it's a great way to start off. So if you are actively sick with the flu, you definitely do not want to be putting anything else in your body to increase inflammation. So you want to be avoiding sugar. You also want to be avoiding dairy. These both can increase mucus production and can also decrease a healthy immune response. So you want to give your body the best chance possible to fight off this flu. So you don't want to be eating bad foods and preventing your immune system from doing its job. Every
week we tell you how bad dairy is. People, please just stop drinking the breast milk from a cow. It's not good for you. It produces mucus. If you have mucus problems, it's not going to help.
Also, make sure to hydrate. We talk a lot about water. Just drink a lot of water. Make sure you're getting electrolytes as well. It just helps our bodies function better in a normal state. But if we're trying to fight off a virus or a common cold, it's going to help that much more.
Rest is also huge. You want to make sure you're resting during this time. If your body's trying to fight something off, this is not the time to be marathon training or cleaning your entire house, Do everything you can to rest up. So if you feel like you're just not getting to the bottom of your health issues with your current doctor, it's time to call Naturopathic Physicians Group. Our office is located in Scottsdale, Arizona. Our doctors are well-versed in all aspects of healthcare.
And today we're talking about the flu.
So to jump back into some naturopathic treatment options, there's something called a warming socks treatment. So this is a form of hydrotherapy where it's a little bit of a misnomer called warming socks, but the way that it works is you use ice cold socks to stimulate the flow of circulation throughout your body. So it's a really great way to alleviate congestion and can actually help speed recovery from illness. Basically, you take a pair of cotton socks, you put them in ice cold water, let them soak it up, get really cold. Then you're going to wring them out completely and put them on your feet. You're going to do this right before bed. You will then put a pair of dry wool socks over top of them and crawl into bed. So while you sleep, your body will actually send blood down to your feet to warm them up because you have the ice cold socks on. And then as the socks dry, your body sends the blood back up to the rest of your body. So it's basically a revamp for your entire circulatory system, sending the blood down to your feet and back up to your head.
This treatment works really well, but I hate it because I hate cold. I'm an Arizona native, and that ice cold sock sucks.
I promise it's not fun when you put them on your feet at night, but when you wake up the next morning and you have no congestion, it's worth it.
It totally is awesome. But the other thing I find with it is that I wake up at 2 a.m. and I'm ripping the socks off my feet because I hate sleeping with socks on. So that's the other thing.
And you can also do something called constitutional hydrotherapy. That's usually done in an office. This treatment combines hot and cold towels applied to your chest, abdomen, and back. And then they use a low voltage sine wave device that adds to the treatment. And this basically forms like a pumping action in your body. It stimulates your core areas, your chest, your back. And at the end, this one feels good because then they wrap you in dry blankets and warm. Warm is good. But this one gets your immune system pumping. It's huge. It's great.
Mm-hmm. Yeah, and your head is not wrapped up. We should probably make that be known.
That is important. Yes, you are not a mummy.
Yeah. And there's also something called wet sheet wrap. This is when your whole body's wrapped in a cold, wet sheet, except for your head again. And then dry blankets are wrapped around your body over the wet sheet. Now, this works the same way as the last two treatments in stimulating your immune system.
So something you can do, especially if you're struggling with the symptoms of a sore throat, cough, congestion, is steam inhalation. So you can do it with eucalyptus essential oil and even add a little pink Himalayan salt into a boiling pot on your stove. You put a towel over your head and put your head right over the pot, and you're just going to take deep breaths and inhale that steam. It can help to kind of clear the mucus out of your lungs, just help you breathe better, and it's a great treatment.
And you have to be careful if you're using essential oils. You don't want to use a lot. You want to, most of the time, it's like one drop. That's how potent it can be. Like if you use too much of them, especially with that steam, you'll feel like you're burning your face.
And also make sure you remove the pot from the stove before you put your head over it.
Or don't touch the pot.
Use pot holders
while it's hot. Don't burn yourself. But again, very small amount. This is usually something that you have to pay attention really closely to make sure you're doing this right, because otherwise you can cause some major problems with it. But that steam inhalation feels really good. The stuff people rub on their chest, like Vicks Vapor Rub, uses eucalyptus oil because it works really well to open up the lungs and breathing. And so you can use the actual essential oil like that. It's very strong.
Mm-hmm. We have IV therapy at Naturopathic Physicians Group that works really well to boost the immune system. Now, we don't encourage you to come in when you're actively sick with the flu because we don't want everyone else in the office getting sick and the other patients as well. But they're really great preventative and immune boosting therapies for leading up to flu season.
That being said, we have treated people who are acute, and it's amazing how well it works. So if you needed it, we could, but we would just be isolating you in your own room, doing all that stuff to be protective to everybody else. But IV therapy, when you get sick, the two nutrients that get depleted first is vitamin C and zinc. So those IVs will have good doses of vitamin C, good doses of zinc. So you can not only replenish what you're losing, but increase it so you can fight off the infection and get back your health much, much quicker.
So in addition to getting some of those nutrients through IV therapy, there are also a lot of supplements that you can take to help maybe prevent the flu or also treat it when you have an acute case of the flu. So vitamin C, a lot of people are familiar with vitamin C. It boosts the immune system. And specifically, there are studies that show it can reduce the duration of a cold or flu by 24 to 36 hours. So I know that doesn't sound like long, but
It's longer than the drugs.
longer than the antivirals, all the way up to 36 hours.
The difference is this one's not going to have the side effects with it unless you take way, way too much. Then you can cause yourself some diarrhea. But this is going to just be empowering to your immune system, though, so it can treat a lot more than just the flu. It'll get you just feeling better.
Vitamin D is another supplement that is really great. And honestly, there's so many people that are vitamin D deficient that I see on the daily. This supports the immune system, and it's critical to fight off infections. And it can reduce the risk of the flu and respiratory infections, including pneumonia.
And we hear all the time, oh, I'm in the sun all the time. I have a ton of vitamin D, and then we test it, and they're depleted. We're not getting that much from the sun anymore. There's a lot of crap in the air that blocks it. People wear sunscreen, which of course is good. You don't want to have problems like sunburns, but when you wear stuff that is a barrier, you're not going to get that vitamin D from the sun. You wear clothes, you wear makeup, you wear hats. You're blocking all of those receptors, so you're still low in vitamin D even if you're out. Now, if you want to sunbathe every day, completely naked, no makeup, no clothes, no nothing, you'll get more vitamin D from the sun, but you'll probably still end up deficient.
Yeah.
So like Dr. Katz mentioned, zinc is depleted when you're sick, so that's a great supplement to take. It can shorten the duration of upper respiratory infections, and it's also actually preventative. It's been shown to prevent cold or flu when used over the course of 5 months, but that was a specific study that showed that.
Quercetin is another supplement that's been shown to inhibit influenza A virus in its initial stages. It makes it difficult for the flu virus to actually enter the cells in your body.
Silver is one that a lot of people don't know of. They've seen it before. They don't know what they do. They use it for burns, like topical silver they use in hospitals for burns. Works really well because it helps protect the skin, but it also prevents certain infections. Well, it works really nicely internally as well, particularly a silver called colloidal silver. Colloidal silver is a great broad spectrum antimicrobial, so it kills bacteria, viruses, fungus, you name it. It supports the immune system, but you do have to be careful with these, because if you get a product that says it's silver and it's silver nitrate and not colloidal silver, you can turn blue.
Like the blue man.
Like the blue man. The ones in Vegas?
No, there was an actual blue man. He learned the hard way.
Yeah.
Exactly what you're
You
saying.
can Google search this and you can find people that look blue. They took way too much of the wrong kind of silver. Colloidal silver should not turn you blue if it's pure colloidal silver.
So another supplement is monolauric acid. This is used in the prevention and treatment of cold and flu by boosting the immune system. Monolaurin is actually a chemical made from lauric acid, which is found in coconut oil as well as human breast milk. So human breast milk has lots in it to protect infants from different illnesses, and monolaurin is kind of one of those components that can be used in treatment of the flu.
For most adults, it's going to be easier to get this from coconut than it is to get it from human breast milk.
I would agree with that, yes. Coconut oil is probably the way to go.
But it's possible.
NAC is also a powerful antioxidant and strong mucolytic. This is short for N-acetylcysteine, but most people know of it as NAC. This can reduce both the duration and the severity of the flu by boosting your immunity. It also reduces respiratory mucus and inhibits the ability of the virus to replicate. And this can also significantly alleviate pneumocyte damage.
So another one is glutathione. You can take this orally or through IV therapy. This is a powerful antioxidant. It has anti-influenza activity and reduces influenza-induced lung inflammation. So this is a really important one, regulating and boosting the immune system.
And two of our favorites for upper respiratory infections and viruses are elderberry and raw, organic, unfiltered, unprocessed honey. Basically, beehive to bottle. It's great for upper respiratory infections. It's great for soothing a sore throat. If you're buying your honey from a teddy bear, you're getting the wrong kind of honey. You want to make sure it's not from a teddy bear. You want it from a beehive to bottle.
Echinacea and golden seal are really great supplements. They reduce the length of severity of a cold as well.
Thanks for listening to Your Health is Wealth. If you have questions about today's show or would like to find out more about the topics we discussed today, call the Naturopathic Physicians Group at 480-451-6161.